broadcast is now starting. All attendees are in listen-only mode.
Hey everyone, good afternoon. I'm Susan Kaufman. I'm here for Attitude Magazine's weekly ADHD Experts live webinar. Thank you for joining us so much today with our expert, Dr. Mark Bertin, who will be talking about what we've called ADHD plus, which is comorbid conditions, specifically how to diagnose and treat comorbid conditions in children with ADHD. I'm sure that most of you who are listening in can relate to what I'm about to say, and that is that it's not at all unusual for parents of children diagnosed with attention deficit disorder to wonder after treatment why some difficulties or symptoms persist. We hear from many parents at Attitude who once the ADHD diagnosis was made, considered that they knew where they were, and in fact, it's not the case because both children and adults living with ADHD typically have more going on. So Dr. Bertin will be talking much more about this, but research suggests that as many as 2/3 of those diagnosed with ADHD have what's called a comorbid condition. That can be a developmental disability, a learning disability, a mental health concern like mood disorder. And these other conditions may be just as difficult and impactful as ADHD itself. So the question then becomes for parents or for anyone living with this, how to evaluate and distinguish between the two disorders, which can oftentimes mimic one another and make for a confusing diagnosis. So Dr. Bertin today will be addressing just that question, how the initial evaluation of ADHD should also address comorbid conditions. He'll be talking about how learning disabilities or anxiety or autism spectrum disorders can mimic ADHD and how they interact with it. Which condition should be treated first is often comes up for people once they have a second diagnosis, and whether to reevaluate an ADHD diagnosis once the comorbid condition is identified. So it's a really important topic. I'm so glad Dr. Bertin's here today to discuss it, and I want to thank him for joining us as always. He has always been a wonderful supporter of Attitude and a great source of helpful information for our listeners. So let me introduce him. He is a developmental pediatrician based in Pleasantville, New York, and he's the author of the Family ADHD Solution, which integrates mindfulness into evidence-based ADHD care. So it's an unusual specialty on his part where he considers a variety of ways to address ADHD. He is an assistant professor of pediatrics at the New York Medical College and on the faculty of the Windward School and the advisory board of Common Sense Media. You can find his blog through Huffington Post or Psychology Today, or you can visit his website, www.developmentaldoctor.com. So thank you again, Dr. Bertin. While I give you some background information about how Attitude webinars take place, I wanted to ask you to complete a poll. We are interested in knowing more about your interests and what brought you here today. So please complete the poll, which you should see on your screen, and we will share the results with you shortly. Meanwhile, for the webinar, you are muted. Please post your questions for Dr. Bertin in the control panel of your screen. After his presentation, he'll respond to your questions as much as time permits. If you have any problems hearing us, dial in via your phone line. You'll find a phone number in your control panel. Any sound problems are due to internet connection. There's nothing we can do about them here. After our session, you'll find a replay of this webinar at attitudemag.com/webinar, and then ultimately a podcast version in the iTunes store. So that is the typical and usual introduction. If you've had a chance to take this poll and tell us what your biggest concern is about comorbid conditions, and if it's other, go ahead and send a note via the chat box to explain what your concern is so we know. And I guess we can show the results. So everyone's interested in the diagnosis problem, right? Distinguishing symptoms of another diagnosis from ADHD and how to diagnose the right condition. So, and then of course, which condition to treat first. Okay, that's great. Well, that's helpful. So with that, let me turn it over to Dr. Bertin to get started, and we'll look forward to hearing your questions after he gives his presentation. Thank you.
All right. Well, thank you for all of that, Susan, and I appreciate the opportunity to be here. You know, obviously it's a huge topic to be covering in a relatively short time, but I'm going to attempt to cover all of that. So really, I think when it comes to talking about ADHD, both on the evaluation side and also on the treatment side, um, it's really impossible to separate out the concept of comorbid conditions. Although I think I would always say that comorbidity sounds like a very medical and intense term, and really what you're talking about, what comorbidity means, are the conditions that tend to tag along with ADHD. And it turns out that in child development in general, things do tend to go along with each other. So this slide is one summary of what Susan said in introducing the topic today, and just looking at all the things that commonly happen along with somebody having ADHD. So in this, this survey said it was 2/3 of people with ADHD have some sort of mental or emotional stress along with it. And that's not even beginning to touch on the educational impact. And really what it means is that when we're looking at ADHD, we just have to assume and screen for and always keep in mind the possibility that something else is happening too. And I want to look at that in a couple of different ways. So really to talk about ADHD at all, I think, and really almost any discussion of ADHD nowadays has to bring into mind the idea of executive function. And that is, for today's topic, is really important because I think it's a lot of how you can start understanding why ADHD mimics other conditions, why ADHD exacerbates other conditions, and also it is a big part of sorting out what's ADHD and what's not ADHD in my mind. So to jump ahead a little bit, for example, there's a very important discussion about the overlap, for example, between anxiety and ADHD. And yet, if you're anxious and unable to focus because you're anxious, that's a very specific concern. It can mimic aspects of ADHD, but just to, again, give a tease of where we're heading, ADHD itself tends to cause a much wider umbrella of issues with executive function, which is a developmental skill set. So from my point of view, one of the important thumbnail ways to start framing ADHD as a parent or teacher in childhood in particular is to look at it as a developmental difference that has to do not with attention, but all of these life management skills. And today's not a big talk on executive function alone, but it is an important framework to have. So when you look at ADHD in this bigger picture, which is how we're going to start sorting out what's ADHD and what's not ADHD, you see that there's an aspect of it that has to do with attention and distractibility and shifting attention, all those things having to do with managing focus. The behavioral piece is the action piece. But then the really overall umbrella of what ADHD is and does has to do with the rest of executive function. And the way I sometimes talk about it with families is really almost anything in life we could put the word management to might have to do with ADHD. Attention management, emotional management, managing our emotions, managing projects, managing time, all of those things are executive function based. So when you look at sorting out ADHD from something else, you begin to see issues with organization planning, time management, prioritization, information management, just like keeping track of stuff in our head and organizing our thoughts before we write or speak or accessing information. There's a big emotional component. And again, we'll talk through in a moment the fact that other things can mimic aspects of this, but so much of sorting out ADHD is about seeking kind of long-term patterns, long-term traits. And really, as a bottom line in sorting out when ADHD is present, which part of a complicated situation is ADHD, this is the heart of it. So when we can really document for ourselves an ongoing pattern of executive function differences that are impairing in life, that's what it means to have ADHD. Part of that process, though, is sorting out what can mimic ADHD. And the reason that's even in this talk today about comorbidity is because it's almost impossible to separate the two discussions out. So many of the things, what makes it all confusing sometimes is so many of the things that can mimic ADHD also tag along with ADHD. So part of the process of evaluating for ADHD is to look for all those other things that can make it look like someone has ADHD. So for example, if someone has significant symptoms of autism and isn't paying attention for more social reasons, like they're just not connected socially in that way yet, that obviously isn't ADHD. It's a focus problem. Or if someone's anxiety is severe enough that they can't focus well enough, that isn't ADHD either. But as I mentioned before, when you look at the diagnostic side of things, which isn't all of the focus for today, the diagnosis of ADHD, comes down to really confirming that pattern of persistent executive function differences, persistent, specific ADHD symptoms that are causing impairment. And so that, really for all the discussion of, I think there's a lot of academic level discussion of whether other things in life can cause that level of executive function difference, can cause that level of disruption. That's the heart of the figuring out ADHD piece of any complicated situation. But for today, I want to take this same sort of look in more detail for each of these things and look at what are the things first that commonly tag along with ADHD. So when it comes to the evaluation of ADHD, these are the things that we have to keep in mind and kind of, to me, one of the examples I often use when it comes, for example, to learning disabilities, and I'm talking to teachers, if you looked at something more medical, like imagine, for example, this is definitely not true, so don't take this out of context, but imagine, for example, that everybody who had asthma had about a 50-50 chance of having some type of kidney disorder also. And when you lay it out that way, it's clear that anytime you diagnosed asthma, you would at least screen for that other problem also. When it comes to the initial evaluation of ADHD, that is entirely the emphasis and the perspective I think we need to take. It's very easy, for example, to assume that someone with significant ADHD symptoms is having problems in school entirely because of those ADHD symptoms. And yet, as I alluded to at the start of the talk today, separate from all the emotional conditions, the mental health conditions that we have to talk about today, there's research suggesting that near half of kids with ADHD often have a learning disability too. And when you look at that 50-50 rate, it means that even at the point of initial evaluation, if someone's having intense academic issues, we have to put in the kind of due diligence to try to screen for this bigger picture of academic difficulty. So what commonly occurs in this bigger umbrella of things that tag along with ADHD, I typically break down, as you saw in the previous slide, around developmental disorders that might mimic ADHD, mimic or co-occur with ADHD. There's medical conditions, a few that we need to touch on, and then there's a lot of mental health that we have to talk about too. So among the developmental conditions that tag along with ADHD are language and motor issues. I often describe it that way to parents, like we don't know why so many children with ADHD specifically have fine motor delays, conditions that have to do with motor skills like dysgraphia, which is a handwriting disorder. But the rate of developmental delays is many-fold higher when kids have ADHD. One that isn't talked about often enough is that language itself is really impacted by ADHD. Communication abilities can be undermined when children have ADHD. Learning disabilities, I'm actually going to come back to in a little more detail in the next slide, because this is the heart. This is the core of understanding ADHD to me. You have a very complicated situation because all of executive function are the skills you use to manage in a classroom. So on the one hand, we have to understand executive function well enough to support a student who's behind in those skills, and then we have to understand that up to half of kids with ADHDs or more have a learning disability also. And autism really is something that the newer diagnostic manual has totally reframed for us. And it was kind of, I found almost silly that, it used to be felt that you couldn't diagnose both autism and ADHD together when actually it's a very common co-occurrence. And so with autism, the simplest way to break the two apart is to look at the fact that autism, from an academic point of view, is a diagnosis of social development, whereas ADHD is this diagnosis, rooted in self-management skills and executive function. So and that comorbidity, by the way, doesn't fully go both ways. So that with autism, some studies say up to half of kids also are going to turn out to have ADHD, which in essence means they have the social difficulties, but they also have these attention and executive function difficulties, whereas the risk going the other, it's not obviously not nearly as high a risk for children who do have ADHD specifically. Learning disabilities, though, may be, I do a lot of work in school settings and around schools, and this is really something that I think is not focused on early and often enough in kids with ADHD. so that when someone's having difficulty academically in school, the thing about, I think one of the things I wanted to make sure I was going to say today is that in child development, there tends, as intense as situations are, there isn't often a day-to-day acuity to it. So we can often, as long as we're on top of things and very involved, be making step-by-step decisions that are going to get us on top of this very complex question of what's ADHD alone and what's ADHD and something else. And when it comes to academics, you're not doing any harm necessarily if you initially assume academic issues are due to ADHD primarily, because if nothing else, ADHD cuts down on the instructional time you're getting. But in the bigger picture, very quickly, you need to move on from that if it doesn't seem like someone's academic issues are going away purely from addressing ADHD itself. And that's because, as I've said several times, this comorbidity between ADHD and learning disorders is quite high. There was a study, I think it was out of Harvard, that showed that 40% of kids could meet strict criteria for reading, math, and writing disabilities. And one of the most primary things I think that is important to address culturally today almost, there's a trend in writing instruction that's really common everywhere I've been around the country, certainly very much so where I live, that has to do with very unstructured writing writing curriculum being used. And really, research shows that near 50% of kids with ADHD are going to meet criteria for a writing disorder. And the simplest way to understand that is that everything you would use to organize your thoughts, access the information you have, and then in a coherent way get it on paper is executive function based. So really, very quickly getting on top of someone who's struggling with writing and ADHD is very important, because that is a really common co-occurring condition. And those children need a very specific type of curriculum intervention to resolve that issue and do well. The second big area of to be screening for when it comes to ADHD and comorbidity are mental health issues. And I think, again, there's two things to look at side by side here. And I often describe it to parents that way. I mean, on the one hand, whenever children are struggling in any way, on a specific level, the most important thing is to get them the supports they need to do well. So on a specific level, the labels and the diagnosis isn't necessarily what's going to drive that. So for example, when it comes to anxiety, I'm going to talk in a moment about how you can sort out what's going on with anxiety. But on a practical level, research around anxiety suggests really heavily that cognitive behavioral therapy is the recommended first intervention and is quite often very effective. It's very different than the research around ADHD, really. So that non-medical interventions for anxiety are often quite useful. They're going to help regardless of if we know the exact specific cause. So when it comes to this balance of, I'm not going to, again, without focusing too much on the diagnostic side of are these things causing ADHD or going along with ADHD, let's just take as assumption for the moment that we know ADHD is going on. In the end, what you want to be doing is keeping in mind that all these things can happen. And then in terms of interventions, especially when non-medical interventions are recommended, sometimes it's through that intervention we're going to sort out the details. So one of the more complicated ones I wanted to touch on in talking about mental health is anxiety, because really the way to look at anxiety as an example of anything co-occurring is that certainly ADHD itself is a very anxiety-provoking condition. In essence, executive function skills are the skills you use to manage everyday life. So having a lot of stress and anxiety because of ADHD is routinely common in essence. And the research says that about 1/3 of kids with ADHD can be diagnosed with an anxiety disorder as well. The flip side of that is that anxiety all on its own, and either as a sort of the more traditional view of worry, anxiety, and being anxious in that way, or obsessive compulsive disorder, not being able to clear your thoughts of things that you're obsessed about, can cause what looks like distractibility and problems with focus from the outside. And then, like a lot of ADHD, there's a middle ground of kids who have both. Really, the bottom line in terms of treatment, which is the most important thing in the long run, is taking things step by step, I think, in those situations. So that on the one hand, we know that if we treat ADHD well, anxiety often goes down all on its own. So for someone who isn't in acute danger in any way, which is typically true, there's often room to just say like, okay, well, it could be there's an anxiety disorder going on here, but the most important thing to do right now is to try to get a handle on ADHD and maybe start some behavioral therapy to help with the anxiety, and then see how things sort themselves out over time. And for many of the more emotional or behavioral things on this list, that sort of step-by-step approach is often the most practical way to go about things. In terms of some of the more complicated ones, in terms to separate out, are certainly mood issues with ADHD. It's important to recognize again that part of ADHD is a lot of emotional reactivity. Explosive behaviors are often inherently part of ADHD until we get on top of it. And a mood disorder in childhood is a whole other condition that again in kids can be very hard to tease out. And I don't have a black and white answer for that to say what is how do you separate them fully, except to say that again, a mood disorder shouldn't be causing that bigger pattern that looks like ADHD. So we can often confirm for ourselves pretty solidly that the ADHD is there, and then deciding whether someone has a full-on mood disorder, which separate from emotional reactivity means your body is basically your moods are changing purely for chemical reasons. Purely having nothing tied to reality at all is the way to separate those two out in my mind. So emotional reactivity are things that are typically triggered by things that actually happened, even if they're complete overreactions. It might seem totally excessive, but there is an explainable external cause, versus things that are changing, for more internal reasons. Like there's just nothing. There's just good and bad days, good and bad movements, disconnected from real life. And that obviously is going to change the treatment plan in the long run, very assertively. But as long as, again, we're involved from the beginning and doing the things that make sense step by step, that's often how we're going to sort out the difference between the two. And as we end today, I'm going to sort of lay that out for what that often looks like. The one other comorbidity I have a personal opinion about, I just want to really mix in here because I think it's an important one to separate for the kids' sake, is that it's very easy when you have undermanaged ADHD to meet criteria for oppositional defiant disorder. But to have that as a disorder, to have that as a true condition, to me means that you are inherently, as an emotional trait, trying to be difficult in life. And the reality is, in my experience, that there are many oppositional behaviors that come up because of ADHD, because kids are overly reactive, overly impulsive, have a hard time sticking to plans. And really, for the vast majority of kids who get labeled oppositional, it really is just part of their ADHD. It's part of the pattern of executive function, that difficulty that's going on. And again, if you can get a really good behavioral plan and often medication to work really well in combination, it's not so much that they're inherently oppositional as they just need a lot of help learning to manage their emotions and manage their lives better. So that's the second part of co-occurring conditions we need to be watching for. And then the third one, which is less, less core to things usually, but important to be watching for on a medical level are medical conditions that often tag along with ADHD. Some of the common ones being sensory issues, which is important to touch on to me because, the vast majority of the time that children have significant sensory concerns, they're caused by another condition. They're not the primary thing going on. They're symptoms of your ADHD or your anxiety or your autism or something else. Kids with ADHD are at risk for tic disorders at baseline, which can be a complicating part of making decisions around medication. And then the last one, which there's increasingly research about, which is an important thing I think for us to kind of understand and monitor for, is that actually being overweight or obese is often an aspect of ADHD. I just wanted to touch on, because I knew I was going to start there as we came back around to this, that certainly there are other medical things we need to think about that can mimic ADHD too, like sleep apnea or severe sensory deficits. But that's really, again, not the topic for today. But in terms of anyone who sort of starts thinking about it this way with ADHD, there's a little more to talk about in terms of the medical conditions that not only co-occur with ADHD, but also the ones that can mimic ADHD. And we can come back to that in the question and answer. So what does all that mean, to try to tie it together before we kind of move on to the questions you all have today? Well, certainly, as a starting point, what it means is knowing all that is possible, knowing that it actually happens more often than not, that there's more going on than just ADHD, it really does need, to me, to be part of any initial evaluation. Some level of screening has to go on to rule that out. The very specific ADHD checklist isn't enough for that quite often. And there's no one way to do this, but at least has to be kept in mind that something else is likely happening. And that might mean that somebody needs more of a developmental evaluation. They need their language looked into. It might mean academic evaluation, medical evaluation. But it's and again, and if you're here as a parent, that's not really your job. It's just something that should be happening, by whoever's doing the initial evaluation. The second thing is that, like all of child development, things tend to evolve over time. They're not just, staying still at all. So that when ADHD care, as Susan alluded to in the introduction, doesn't seem to be proceeding like we want to do, things aren't going as well as they were, or they're not going as well as we thought they would, one of the first things to go back to is to step back and say, did we miss something that might be co-occurring with ADHD here? Which might mean another level of evaluation. Do we need a full neuropsychological evaluation now, or a specific educational plan evaluation or plan put in place? And I think just being open-minded as clinicians and parents and willing to question our own judgments in life, which I think is an important trait for us all to have, I think we just have to reconsider our assumptions. Do we thought this was only ADHD, but now things aren't progressing and we need to readjust? And that goes both in terms of the evaluation and, as I'm going to touch on next, in terms of the interventions as well. Because, really that's, I'm sure, what most people are here to talk about on some level. I mean, in the end, all of ADHD management comes down to trying to help someone who's struggling in some way in life to thrive, to sort of cover all of this wide-ranging experience of having ADHD. ADHD is really can affect almost anything in life that involves those management skills that are needed. And I think when it comes to this concept of what's co-occurring with ADHD, there's an evaluation side of it to look at. But really, thankfully, on a practical level, a lot of the times, if we just focus on getting the right supports in place, the details of what's required or what's going on in terms of co-occurring conditions are going to sort themselves out. And to me, all of ADHD management is kind of constantly readjusting what I've lately been picturing as a pie chart. We just got to fill in all the pieces from all the different things we know might be going on with ADHD, and particularly for the non-medical decision making, a lot of the times we can get those supports in place, even if we're not 100% sure, what's leading what in essence. So that from an educational point of view, on the one hand, we can keep doing medical, we can update our educational evaluations as often as possible to make sure we're not missing a learning disability. And on the other hand, a lot of the interventions that help children with executive function differences and with learning disabilities really help all students. So we can look at it on two levels. One is diagnostically, but one is more specifically like what educational supports might be useful next. When it comes to family and behavioral supports, like I said earlier, for conditions like anxiety, behavioral therapy is often quite useful and also probably going to be helpful regardless of whether we know fully whether it's a ADHD causing anxiety or whether it's two separate conditions going on side by side. And the same thing goes for parent support. So parent training is a very effective part of ADHD, for example, not because parents are ever doing anything right or wrong, but just because parents often need a lot more tools, a lot more resource of ways to manage behavior, because ADHD makes that very hard at times. But those behavioral interventions can help a ton with someone who's acting oppositionally, again, regardless if we know exactly what the cause is initially. With ADHD, it's always about keeping track of the big picture, making sure we're moving in the right direction over time. And as long as you stay involved and engaged, over time, all the details will sort themselves out. A third aspect of ADHD and sort of co-occurring conditions has a lot to do with everyday health. And it's that same sort of vicious cycle ADHD often makes, so that sleep disorders can mimic ADHD, but sleep disorders often co-occur with and exacerbate ADHD. And yet the beginning point is just looking at that as like, all right, there may be something more going on here, but let's start with sleep management first. And then when it comes to medication, this is where things do get trickiest, and I bet you there will be questions on this in the follow-up in a moment. But really when it comes to medications, I think largely it often, to me, comes down to a stepwise intervention having to do, first of all, with what we know is easiest to manage and has the fewest side effects, which, in spite of how they're talked about, is often the ADHD medications. Some of it also has to do with just that acute judgment of what is most disruptive right now, what is most difficult right now. So on the one hand, we could decide, just to come back to anxiety again, that ADHD is a really significant piece of this. ADHD medications are very short acting, so let's see if we can, what the impact of starting a medication would be. And the flip side would be, if we really see a pattern of ongoing anxiety, we might try a trial of an anxiety medication with that same open-minded view of, okay, we're just going to see how this responds and see if this is covering things enough. So the medication, like most everything else, just needs to be done kind of methodically in a stepwise way with our best judgment of, are we certain there's two disorders going on yet, or do you want to try addressing the ADHD first and see how everything else responds? And I think all of ADHD management comes from this kind of large-sighted, step-by-step view of managing all of ADHD, whether we're talking about ADHD alone and its executive function impact, or whether we're talking about ADHD and a comorbid condition. So, so that's an overview of obviously a very large body of information. And I guess I will pause there. So I'm curious to hear what questions come back at this point. So, thanks for your attention, and let's see what's come up.
Okay, everyone, listeners, please go ahead and post something about your family situation, your child, and what your interests are. And Dr. Bertin, one question I have, can you sort of, I think one of the things that people are puzzling about, sort of just reading through the lines with the questions, is sort of the trajectory of things. So in many cases, I think a child maybe age 6 to 8 is diagnosed often by their pediatrician with ADHD. At what point then should the parent, what symptoms might occur, and that a parent might say, okay, I need another diagnosis, and at that point, should they go back to the pediatrician? How should they proceed? I think that's where many of our readers find themselves. They had a early diagnosis with the pediatrician, and that's kind of where they are, right? And the pediatrician usually did not consider comorbidities at all.
Right. So I think there's two sides to answering that question, and on the one side of it has to do with, and again, I never want to put all this on parents directly, but just being aware of that model I just laid out of knowing developmental learning issues can be going on, and that mental health issues can be going on, and that medical issues can be going on. Really, again, short term, it's okay to just say, all right, let's start with ADHD. But that decision as a parent, whether more needs to happen, really comes down from just looking, it's really just knowing your own child and saying, okay, something still is going on in school here, or he just doesn't seem happy, or, so that the decision about whether it's time to seek out a more detailed evaluation really just has to be a very low threshold, because we know the likelihood is there's more going on.
That's pretty important.
Just having a really low threshold for saying, like, you know what, we thought it was ADHD, we started intervening for ADHD, and it's still not working out. There's clearly, there's still some, you remember, impairment is part of the diagnosis of ADHD. So, that there's something going on to make the diagnosis. So to answer the first half of your question, that's the whole model here. That's what we have to talk about, is just to having a very low threshold for saying, we need more here because we thought it was ADHD, we're doing something for ADHD, and the pieces haven't come together yet.
Yeah, I think one of the complicating factors that I hear from our readers is that they oftentimes aren't sure that the treatment for ADHD is right, that they have the right medication, the right dose, and so they don't know whether whether they've not got the ADHD treatment right, or whether there is something else, and then that's complicated.
It's very complicated, and it's almost like an entire other talk in essence. I mean, so on the one hand, absolutely, one of the things you need to be confident as a parent is that ADHD is being thoroughly and effectively treated, which is never one intervention, and there's the medication piece and the health piece and the behavioral piece and the school piece, and that all on its own is complicated enough that you really, truthfully, and I have to say this with all respect to general pediatricians, my initial goal was to be a general pediatrician who was interested in this type of care, and then realized that, the way our medical system works, just, really from at least the way I wanted to do things, didn't allow time for that.
Right.
And
5 minutes later, you have to see another patient, right?
So it wasn't the only, I mean, I was always interested in the field that I'm in now, but that was certainly a piece of how I pictured things. And part of what you have to look at is that addressing all of this thoroughly just requires a lot of understanding of ADHD and a lot of coordinating many different interventions that are useful. But but again, that's not directly around the comorbidity. I would say the easiest answer in that moment of trying to know what's going on is to recognize that if you're not sure, because the rate of comorbid conditions is so high, the way to sort it out almost always is to err on the side of the rest of the evaluation.
Okay.
Because you're right. On the one hand, one discussion we need to have is, are we really covering all of ADHD here? But there's no point to waiting very long for the second half of it, because it's not like it's an invasive examination. There's cost issues if you want to do like a neuropsychological evaluation,
Right.
but a lot of it can be done through a school district, for example. So, so when it comes to educational problems, if there's a 2/3 risk of learning disabilities, really what it means is we start intervening for ADHD, and as a parent, you have the right to ask for a more intensive educational evaluation as long as the issues are persistent, whether or not people assume it's because of focus.
Okay, so that's helpful. Basically
so
just saying err on the side of assuming
100%.
Yeah, that's
I mean, don't, and it's not your job as a parent to sort it out. One of the most important things I think sometimes is to reassure yourself one way or the other. Don't be home worrying about it if you can avoid it by going to somebody to do more of an evaluation and just kind of, trying to get a more concrete answer.
Right. So, and then in terms of what evaluation, it varies, right? If it's learning disabilities, you're going to have to go educational route. If it may be anxiety, you may go to a child psychiatrist, etc.
Absolutely.
Right?
Yep.
Yeah. So that's of course.
And yeah, so that's going to be specific on what you're worried. Yes, absolutely.
Right.
And then one other thing to know is that some of the times these things do overlap. Like if anxiety is, which can be one of the most confusing parts of ADHD to sort out, is going on, one of the things that you can know is just getting started with working with anxiety with a good psychologist is often a way to is to sort it out in and of itself. The psychologist, through doing the therapy, is going to be able to help sort out, what's causing what.
In terms of psychologists and behavior therapy, I don't know if you know this or the listeners know this, but we did a very comprehensive survey, and over 4,000 attitude readers responded as to how they're treating their child's ADHD. And we were very surprised that so few people were using behavior therapy. So surprised, in fact, given that it's the #1 recommendation of the American Academy of Pediatrics, right. So surprised that we went back and did a follow-up survey and asked why not. And the answers were, basically extremely expensive, hard to find, logistically difficult. So there's some real impediments to people in terms of,
the reality of that is very, that is the reality of it. And, and there are, there's no easy answer to a lot of that. And, and even one of the simplest answers, which is, sometimes you can get it added to like a school plan, that kind of thing helps a little bit. The truth is that many behavioral interventions in childhood ADHD rely on a lot of parent involvement, which, doesn't usually happen if it's, when it's just when it's only the school psychologist working with somebody.
Right.
But that side of it, the fact that it takes so much time and effort to do anything behaviorally is definitely a major hurdle for
and here's
a lot
a
of people.
person who just posted, how, as an ADHD parent, I just don't feel that I can manage behavior therapy. That's another impediment, right? I mean, so anyway, it's not easy, as we know.
It isn't,
There's a bunch of very specific questions. I'll move to some of those now because they're interesting. Listeners were intrigued by your comment about obesity and its relationship to ADHD, and they would love to know more about that. What is the connection?
I think it's an interesting part of ADHD, and actually sometimes overlaps even with the discussion of medications to me. So there's been more research, mostly in adult medicine, looking at how if you look at ADHD as a life management disorder, not as an attention disorder,
Mm-hmm.
I think what you find is that a lot of kids with ADHD, they just overeat. They're not. I picture it as, it's distracted eating and not paying attention to body cues, and maybe eating too quickly and a little impulsively, and maybe
Mm-hmm. Sort of the basic symptoms of ADHD playing
they
themselves out
playing
in.
themselves out the food.
Right.
Yeah, and what you find is that first of all, if you can recognize it, you can start working with it, which is important, and it's hard. And it does, unfortunately, it often falls under the umbrella of behavior, but there can be a parenting side to it. You can use tools like mindfulness with that, but first you just have to identify that it's going on. And secondly, I do think it sometimes confuses the medication picture a little bit.
Mm-hmm.
I don't really, I think, again, whole other discussion of what we think about the medications or not.
Right.
But in the end, one of the things that often looks like appetite loss, certainly that's a common side effect of ADHD medications. But the flip side is that sometimes what you see is someone who really doesn't have appetite loss. It's just that they are for the first time in their life eating healthily.
Mm-hmm.
So they're eating less, but now they're eating well. It was that that even though it looks like their appetite's changed a bunch, it's really that
Right.
their baseline was off.
Right. Right. Interesting. A number of concerns about, maybe talk a little more, address more treating anxiety and ADHD simultaneously. Which comes first? How do you differentiate the two?
Right.
So who would treat that, and how would that be addressed? Some questions here, both from adults and parents.
I think first of all, I think it is an important part of ADHD care when kids have ADHD and anxiety to often, like I said earlier, focus on like what do we know might be helpful initially, as opposed to trying to fully separate two things that are really on some level inseparable.
Mm-hmm.
So I think making decisions about what to do, I think there's two levels to think about it really. On one hand, we know ADHD, because of its impact and it just makes life stressful. Everything that could be routine doesn't necessarily feel routine, and it produces a lot of anxiety.
Mm-hmm.
That again, it's getting it has to do with getting to know someone individually, but one of the first steps to managing anxiety can be just assertively managing someone's ADHD. But if there's a lot of anxiety going on, we're going to couple that with behavioral therapy again, because when you look at research in anxiety, that is the first line treatment, is cognitive behavioral therapy. Mm-hmm. So we're sort of addressing it regardless of if we know the exact cause. And then what we often find is because we can start managing all the ADHD symptoms and that settles down, anxiety goes way down. It used to be, for example, that they said, and I never really want to, I should just state it because I always feel like saying it at some point. Like, I don't really consider myself for or against medication. I just want objectivity when it comes to discussing medications. Mm-hmm. People often ask, are you for? It's like, it's not about that. It's like, we know they're safe.
What works, right?
We know they're safe and effective when they're used well. And often what you see when they work for ADHD is anxiety levels go way down. So it's a perfectly reasonable first step, in the big picture, as long as there's nothing acute going on, to say like, mm-hmm. Okay, let's try this first. So, and that may be what some of these questions are alluding to, is they used to say that you shouldn't use ADHD medications for people with anxiety, but that's really not true.
Right.
That's not really standard of care anymore. What you have to be aware of is that a potential side effect of the medications is it cuts both ways. A potential benefit of the treatment is lowered anxiety. A potential side effect of the medication itself is increased anxiety. And a lot of the times there's nothing more to do than just try it and be really closely involved in monitoring whether things are getting better or worse that way. Mm-hmm. When it comes to the medical side of anxiety, really it comes down again to knowing yourself, I guess, if you're an adult with ADHD, but working with someone you trust, because it's really, it's really the same answer in essence, in that you have to look at a little bit of triage almost of like, what feels worse right now? What's most disruptive right now? And that often is going to be the starting point for making decisions. So around, again, around anxiety, the triage of it, the intervention of it is usually behavioral therapy followed by medications, unless someone's in a lot of distress. And then if you're deciding, clearly we know both ADHD and anxiety are going on here, in the long run, you're probably going to end up trying, if you're going to try interventions for both, and deciding what comes first, I think is just, it's an individual decision based on that situation of, what feels like, we need help with first.
Mm-hmm. Just wrapping up a bit on behavior therapy, question about what professional is best suited for this? The question is a psychologist, licensed professional counselor, social worker. I think there's just, some uncertainty around how you found a qualified behavior therapist.
I mean, I think finding a qualified behavioral therapist really has to do with finding, I usually think about it in two parts. I mean, half of it is somebody who is clinically skilled, which in this situation, in this case, talking about ADHD means somebody who two things. One is they really understand ADHD, and one is that, the typical first line recommendation is cognitive behavioral therapy, not psychotherapy or play therapy.
Right.
So you're looking for, so it doesn't matter, whether they're a social worker or a psychologist specifically, as much as that they have a cognitive behavioral background around ADHD. The other half of choosing a psychologist, though, is that they really just have to be somebody you click with. I mean, it doesn't matter how highly recommended they are if you don't like them, and that's an important thing to put into the mix. But I don't think that you don't have to focus so much on their specific training. Like, it's not like comparing a clinical social worker to a psychologist is going to get you much of anywhere. It's more about for an individual clinician, whether they have this type of training, this type of skill set. And the best way to do it typically is to, is through, referrals, obviously, is hopefully either your school system or your pediatrician or the local special ed PTA, somebody can vouch for somebody. And, so that, I mean, and the biggest hurdle often is, insurance coverage and time,
Yeah, to your point, in the responses as to why not behavior therapy, we did hear a lot of comments just about not clicking personally with the therapist, or parents feeling just criticized. I mean, one person said, I spent a huge amount of time and money just to be told that I'm a bad parent. I remember that quote was really painful. I know.
Yeah, that's awful.
So, yeah.
And there's, the problem with behavioral therapy getting started is, I always picture it as like pushing a boulder over a hill. It is, hugely effortful. And if you have ADHD as a parent, they are often things that are, they're hard to get started with, but they're not impossible. And if you're working with a good clinician, they're going to help you problem solve that too. And it is the sort of thing where in most situations, there's going to be, just to go back to the analogy, there's going to be a lot of effort pushing uphill first. But what you're going to find is that the tools, most often do work. Again, they don't work necessarily on their own. It's not like any one thing manages all of ADHD, but it's going to help things feel more under control and more manageable. And most importantly, for early childhood behavior, sort of parent-driven interventions change things quicker than child-driven interventions in early childhood, just because they're kids, so that your ability to help them learn new behaviors through tools that you're given is typically going to be quicker to take hold than somebody working directly with them.
Right, and then the whole concept, it's a couple of people that said, quote, cognitive behavior therapy turned out to really be talk therapy with their child, which really is not what we're talking about here.
No, that is not. Cognitive behavioral therapy is very skill-based. It's very practical when it's done appropriately.
A little comment here that I'll just interject to support this topic. Someone writes, my son's 13. He was diagnosed with ADHD when he was 8. We kept thinking there was something more. 5 years later, it's been a process. We're finally getting the help we need. He's been diagnosed with anxiety as well as being high-functioning autistic. And I think that comment is really something that we hear a fair amount here at Attitude. So maybe we could segue now to autism and ADHD and how they interact, and any comments you might make about distinguishing one from the other.
Well, I think, I mean, I guess, again, to look at it diagnostically and then treatment-wise. In terms of diagnosis, to say someone has autism, I think the simplest way to understand it is that social development happens intuitively for most people, and with autism, some aspect of social development hasn't. And on the extreme side, you have kids with severe autism who are, not very connected with others around them at all. But on the very mild side, you have kids who can be quite extroverted, but don't intuitively understand the social world. The flip side is that clearly ADHD can impact social development. Well, that's actually, I said that poorly. ADHD can interact how you're doing socially as well, with the difference being that on a more intuitive level, you really do understand the social world. And Dr. Barkley has that great one-line description of ADHD, that ADHD isn't a disorder, to paraphrase it, ADHD isn't a disorder of not knowing what to do, it's a disorder of not doing what you know. So for someone with ADHD struggling socially, it's not that they don't understand social cues or understand how to interact socially or have a conversation, it's that their impulsiveness and distractibility and executive function issues are getting in the way socially. So that's how you, on a practical level, that's how you try to sort out like what's what. The catch is that about half of kids with symptoms of autism have ADHD also.
ADHD, right.
But it really is a situation where part of it has to do just with awareness. Most kids with ADHD have moments where you can really get a sense that, oh yeah, they understand the social world here. They were just too impulsive again. And part of it has to do with really just focusing more on support and intervention more than diagnosis initially. Because, if someone has mild symptoms of high functioning autism, getting them the right social supports is the right intervention, again, regardless of cause. And if someone with ADHD has ongoing social and behavioral difficulties in spite of all the other ADHD treatments, it's kind of the same first step anyway.
Right.
So yeah. I think it feels, it's not, and it's not fully, separable always, but really on a practical level, it is almost, it really comes down, and it might not be something you can know immediately about someone with ADHD, because your ADHD symptoms may mask your true social intuition.
Right.
But at the same time, over time, that's going to sort itself out.
I think.
So yeah, in the short run, the supports are what matters.
Right. Parents just feel, I think, and I understand this, really in need of a statement.
Right.
That this is not just, it's hard to.
Uncertainty is exhausting and stress-inducing,
right.
And yet there aren't always black and white answers.
That's right. So the question here related to this is, what's the difference between academic evaluation for autism and medical evaluation for autism? Is there academic evaluation for autism? I wouldn't think so. No.
Well, there is no. No. Autism, like ADHD, is a clinical diagnosis.
Right.
There is no useful medical evaluation for autism.
Right.
There are things you might screen for because someone has autism, but that's not how you make the diagnosis. So,
right.
So to diagnose autism, really to me is a lot like a good ADHD diagnosis. It's just somebody has to put in the time to know somebody well enough to really look at that aspect of their development thoroughly.
Right.
So for autism, the focus is more on social and communication skills.
Yep.
And that's really what the evaluation comes down to.
Mm-hmm. There's a question which takes us into the realm, I think, correctly, of the learning disabilities. This person says, my granddaughter was diagnosed with ADHD, takes medication, and received behavior counseling. One of the observations that we have is that her writing is illegible. She's now 18 years old. Listening to the term you use, dysgraphia, I'm wondering if there's something else we should be looking to do. And I'm guessing your answer to that sounds like a learning evaluation is in order.
It's tough at 18. Handwriting specifically is something that this is where one of those places where really strong education benefits kids with ADHD from day one. In ways, with or without learning disabilities, a lot of direct instruction in specific skills, so those skills become fluent, is useful for all students, but near vital for kids with ADHD, and that's even without a diagnosis of a learning disability. But
Mhm.
absolutely, if you're undermining yourself in some way because of something as specific as your handwriting is completely illegible, you can look into it and get diagnosed. The catch with handwriting in particular, you're banging up against something called motor memory, which is that learning handwriting is kind of like tying your shoes. If anyone's ever tried to learn how to tie their shoes differently, having done it one way their whole life, it's really hard because it's just kind of like it's a learned pattern.
Mhm.
So unlearning handwriting at 18 is tough. It might have more to do
Right.
with teaching someone to type well or something
Type
else,
well. Yeah.
So
Yeah.
sometimes it's about accommodation at that age.
Yeah.
But certainly if it would be an educational specialist who could help sort out whether there's a true handwriting disorder there.
Yeah, to that point, we've had some wonderful educational experts talk about tools such as dictation tools and all sorts of tools for kids who have difficult handwriting. And there seem
Absolutely.
to be a large number of things that are better than, as you say, trying to unlearn the way you write. So a couple of questions on trauma, chronic exposure to stress, and how to distinguish those symptoms from ADHD.
That's a huge question to ask too, sort of as we're reaching an end, touch base on.
Sorry,
I
okay.
think, no, it's perfect. It's perfect, but I'm just trying to. So, I mean, the issue when you talk about trauma is that trauma is really that our understanding of just brain development in the body is so different than even when I was in medical school. We now know that there's something called epigenetics, which means epigenetics, which means that our, how our genes express themselves is somewhat influenced by intense life experiences. And like no one, by the way, should take this home as another thing to stress over. That doesn't mean like normal day-to-day stress, but situations that are truly traumatic and overwhelming, physically cause our brain and our bodies to grow differently. So that in essence, you have, just like everything else we talked about today, a situation where, trauma and PTSD and all the related symptoms can certainly mimic ADHD in some level, but extreme stress and trauma probably put you at risk for actually developing ADHD. I think that, like everything else in today's discussion, it comes back to being, methodical and open to adjusting depending on what you've decided, and really just trying things out, so that if somebody with a history of trauma has that larger pattern that looks like ADHD and executive function, maybe, you start by trying to treat ADHD, or actually if it's trauma, you're probably already doing therapy at the same time, and I think it really is, in many ways, just a perfect example of how to sort of compassionately and open-mindedly look at the whole big picture of all of this is going on. Knowing ADHD well means, really recognizing that picture of life management difficulties that suggests, okay, executive function may be the core of this. And if you think that's likely, then you probably want to give some thought to addressing it. But because those challenges often go hand in hand for someone who's suffering on in that way, clearly you just want to be direct in offering all the supports you can. And so it just means being open to again getting that whole, I think it sort of means keeping both things in mind. Just because, or not just, but you wouldn't want to use trauma to explain away ADHD when there's a pretty good chance someone has both. So and I think that's the most important thing, is being open to sort of questioning your assumptions and recognizing that, if the intervention for trauma isn't getting far enough, maybe it's still ADHD, or if the intervention for ADHD isn't going well enough, maybe it's that we have to get back here and really look into the roots of trauma more.
Right. Yeah. Okay. So we have little time, and I'm going to just do one question, which is also, worthy of an hour or so, related to bipolar disorder. One person is asking whether her child's ADHD medications could be responsible for having developing manic symptoms that seem to be bipolar. And another person, I think these two questions are related, so I'm putting them together.
Sure.
Another person said that you mentioned that mood disorders were purely, quote, purely chemical. And could you elaborate on that? So I think what's being asked here is, the relationship between manic behavior and its manifestation in bipolar versus ADHD.
Right. I think, and then there was the question about medication too.
Right.
From a diagnostic point of view, ADHD causes a lot of emotional dysregulation, but the way it causes that emotionality is kind of, to me, like you're not really managing your emotions particularly well, so that in kids that shows up as just a lot of overreactivity to things that maybe somebody else might think aren't that big a deal. Quick to anger, quick to frustrate, and quick to frustrate, and they can be epic tantrums and outbursts too. But in essence, really when you look at the big picture, whether or not we agree with the trigger, there tends to be a trigger for all of it. A mood disorder is more like a neurological or neurochemical dysregulation, meaning, that baseline variability of mood or explosiveness or moods going up and down can be triggered by, it can truly, like manic episodes can be triggered, but in the bigger picture, you're going to see a pattern of things that are, unexplainably variable when it comes to emotions that aren't so, directly connected to something making them happen. And that, and it isn't so perfect, they're both can, certainly look like each other sometimes, but broadly speaking, that's what separates the two. And it's very easy to misdiagnose someone with ADHD as having like an explosive disorder or as having bipolar, but in the end, it wasn't that many decades ago that kind of explosiveness was actually part of the diagnosis of ADHD.
Right.
When it comes
I've also heard it described as the ADHD person's mania and moods happen quickly in response to events, whereas the bipolar disorder, this is a gross generalization based on my understanding, takes place over longer time frames and independent of anything that's going on. And just
well, I mean, yes, and the reason I'm hesitating the reason I didn't say it totally that way is bipolar in kids, the switches aren't always as far out.
All right.
So but that is what you're saying is generally accurate and not always as clear in kids.
Okay.
In terms of the one question about medication, just to touch on it, the medications don't cause. I mean, it's just really part of the trial and error of all the medications. Is the medications can help when someone has ADHD and symptoms of mood disorder, but absolutely the medications can exacerbate a lot of underlying mental health conditions. So if there's any concern like that, you definitely want to be talking to your, whoever's prescribing.
Okay. Great. Dr. Bertin, thank you so much. Thank you everyone for listening in today, and I hope you have a great weekend. This is a really important topic, and I hope we've been helpful, and you'll find the audio on our site within a short time, as well as the slides to download. Dr. Bertin, I hope you'll come back.
Anytime. Yeah,
okay.
Thank you so much for being here.
Thanks, everybody.
for having me. Take care. Have a great weekend.
Bye. You too. Bye.